folks. Let me introduce Scott Ashley. He's the president and CEO of Get Ready Online Inc., an organizational resilience, professional services, and tech company that provides relevant emergency management, emergency operations center, and business continuity planning, plus infection control programs. That's always important. Get Ready has a custom Canadian company. It's cloud-based and enables their customers to gain easy access to emergency information at their desktop, or I guess on their mobiles, depending on what's happening with the desktop at the time. Get Ready is an NRC IRAP partner, further enhancing Canadian expertise to respond to incidents with speed and confidence. And they also have 12 years of experience. Well, Scott has 12 years of experience in EMS. In his early years, he was a paramedic in Alberta, LA, wow. City of Toronto, EMS, and ultimately he worked for 8 years for critical care flight paramedic on Bandage One helicopter based out of Toronto. Scott has founded companies that focus on incident management programs, solving problems for Fortune 500 businesses, hospitals, professional firms, and all levels of government. Scott is a member of the Canadian Chamber of Commerce, Business-Led Recovery Council, and a co-founding member of FedDev-sponsored Niagara Falls Ryerson Innovation Hub. Safe Site Global also consortium. So I kind of did a mouthful rapidly. Scott, you're going to do a better job. Over to you, Scott.
Geez, well, thanks, Bernie. It's a real pleasure to meet all of you, and thank you so much for your time. It's a nice sized group today, so I'm going to be, I'll go through the slides. There's not a bunch of them, not too many, so I'll get through those. And if there's anything that pops up and you want to talk about it, just we were talking before about raising your hand and stuff, but it's a fairly small group, so just speak up and we can have a conversation. But at the end, we're trying to save some time so we can have some questions and answers, or just a more continuous discussion. So yeah, with that, let me share my slides here, and I'll just sort of go through these. So Get Ready is our company, and we came up with the name because in Canada, the emergency management is Get Prepared, and in the States, it's ready.gov. And we thought, well, everyone knows the term get ready. Come on, get ready, kids. We got to get in the car, get ready for this, get ready for that. But we thought it sort of made some sense, and we call it readiness. And do you have readiness? Are you ready to go, and stuff like that? So that's really the goal of it. We've got about 45 people, all from either sort of a critical care EMS background, police, RCMP, and I differentiate the separate, part of it. We have different people from hostage and bomb techs and so on, fire and emergency management, and obviously we have some tech people as well. And it was an interesting story, but I'll tell you at the end here, we did a merger, and I think it's the second last slide, but we did the merger to create Trillium Health Partners in Mississauga. And that was taking Credit Valley Hospital and Mississauga General and another one, over 14,000 employees, 3 hospitals, and they all had different systems. Well, we built this, we separated policy from procedure, which I'll talk about, but we created binders, and the binders had to be this thick. And I said, oh my God, this is the last time we're doing this. And every single person walking around the hospital always had their phone in their hand. And I'm like, you know what, we need an app. And so we started building that, and that was really so that you could have instant access and the information right at your fingertips. What do we do when there's a bomb, a spill, a shooter, a flood, this, that, the other thing, right? So, but what I want to talk about is not just what we do, but the guidelines, the premise that we work in. Because we have all of these, emergency response specialists, one of the things we found over the years, and part of the reason we started this business, every time we went to a disaster or an emergency, as paramedics, as police, whatever, everyone always said the same sort of thing, well, I was just going to call 911. Well, you need to have plans. You need to be prepared before that. And so when we start looking at it, you need to create a list. And this 5 points, is really critical. So create the risk factors that your organization is mostly concerned about. If you live near a floodplain, think about floods. If you're think about forest fires, think about the stuff we're seeing in the news. Are you is a cyber attack a concern for your business? Would you be out of business? Your supply chain, all that kind of stuff. What are the incidents that are going to impact you? Do you have a warehouse? Do you have an alternate warehouse? things like that. And then a lot of organizations will build giant policy documents, and they're lovely if you're an auditor or you like to read millions of pages, but they're not practical, because when the building's on fire, you don't want to flip through to page 32 and go, oh, this is what the staff need to do, and then go to page 45, and this is what the manager needs to do, and then go to 211 and find out what the owner or the executive team or security or whatever, right? So what we've tried to do is separate those policies from procedures. People always say the same thing: just tell me what I'm supposed to do. And that's their checklist, and that's what we really try and separate. So when you're thinking of making policies, they call them policies and procedures. Keep it that way. Keep them distinct and separate. Make it accessible through a cloud tool if you can. Make sure that it's not in your own system. If your own system gets hacked or goes down, or you have a cyber attack, you lose all your information. And we use a Canadian company. There's 3 approved by the federal government: Microsoft, Amazon, and a company out of Toronto called ThinkOn. And they're a risk-based, risk level secure company with the federal government, and they offer Canadian domiciled, cloud services. So it's not in the U.S. It's not. They have the ability to go into the U.S. and the U.K. and different places around the world. But for our clients, hospitals and municipalities and businesses, they want to know that the content is in fact in Canada. So that's an important piece to think about. Training, regular training, practicing, exercising is really important. They're called perishable skills, and all of you, I'm sure, at some point have taken a first aid course or a CPR course. Well, the average is they'll estimate that 75 to 80% of the information is gone in 6 months. And yet they give you a 3-year certification. And it's like, guys, if you haven't taken a course in 1,000 days, don't touch me, right? You have to practice this stuff and think about it. And where is the first aid kit and all that kind of stuff? Well, where is your emergency plan? If you were developing a business continuity plan, how often do you need to update who your suppliers, your vendors, all those kinds of, all that information needs to be updated and practiced and reviewed. So anyways, that's really the focus of it. This is what our tools turned out now. This is in a hospital setting, but it applies to some of our other clients, industry. Sanofi Pasteur, the vaccine manufacturer, is one of our larger clients, and they use this for all their emergency capabilities. But they'll pick a code, so they'll hit emergencies, and you can see all the different codes there. And then what happens is this, and this is how we roll these out. You want to keep it simple. Call, pick, and click. Call for help. Pick the incident type. Oh, we have a hazardous spill. Click on that. And then if you're switchboard, staff, security, the team, the department, the manager on call, the executive team, whatever, click, and there is your checklist. And it's like lines in a play. This is what you're doing. This is what you're doing. This is what you're doing. And people love it. Your training time is minimal because it's easy. It makes sense, and they just follow their list. But it's finding that list in a disaster, in an emergency, in a fire, a flood, a power outage. Where is that? And you have to keep it simple. So you can put it on desktop, you can put it on their mobile, easy stuff. For larger organizations, we have these forms and dashboards. So we can be looking for a bomb in a university campus or a building or a shopping mall or something like that. Well, by the time you get all the information from all the different departments and sites and stores or whatever, it takes a long time. With this app, people can go, I'm in building 5, I'm in department 7, and I checked here, click, 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 and hit submit. And then they can see live in real time who's found it, who didn't, who's completed their search, and they know who's evacuated the building if we had to get out for a fire. Who's locked down if we had a shooter or we had a problem. So these are things that people want instant information on. We have this incident tracker. So if you're a multi-site organization or a large organization that has a lot of things on the fly, then you can see live in real time. This is an example of Brantford Hospital, but they could have a code blue, a cardiac arrest going on. They also have a missing kid. They also have a spill, and they have a code white. So someone's, having a fight in the emergency department or something like that. And you can see this on the desktop. And for the executive to decide, where do we send resources? How do we support our people? What's the risk management? Did we make the right decision? Well, you can see in real time what's going on and when some things are ramping up and other things are starting to clear and come to an end. This is what we call Incident of the Month or Training of the Month for our EOC programs, for our first aid stuff, for our infection control. People, if you ask staff and managers, do you have an hour, 2 hours, half a day for training? Nobody ever does. It's hard to book it. But do you have 5 minutes? Yeah, they got 5 minutes. And they'll watch a 3, 4, 5 minute long video once a month. They answer a couple little multiple choice questions that are continually randomized so people can't share the answers. And that's what provides validation to the testing. They watch, what do I do for this? A fire, a flood, a spill, whatever. What if we have a tornado? What do I do? Click, 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 click. They hit submit and the management can see and pass. And when we put this program in at Niagara Health, down in the Niagara Falls area, it's the largest multi-site hospital in Ontario, 7 locations, 7 sites like St. Catharines and Fort Erie and Niagara Falls and so on. And they did a lot of things really well when it came to accreditation, but they didn't get it all. And one of their big stumbling blocks was proving that they trained their employees and their staff and nurses and everyone, right? And what they would do is huddles. Well, when we brought in the LMS, they could all watch it. And we knew they watched it because they had to log in and do the test. And within, I think it was about 6 weeks, they ended up getting their full accreditation from Accreditation Canada. So it was really seen as a big win. Our Emergency Operations Center, we run this for municipalities across Ontario right now. And this has been a part with the National Research Council to bring that greater situational awareness to the tool so they can see when the fire trucks arrived or when, OPP or whoever, so we can get a sense of what's actually happening better at the scene. But this has saved, again, it's people are mobile, they're on their laptop, they're on their mobile device. With COVID, they're not all going to be sitting in the boardroom. And so instead of having binders and paper, they're able to do this. And let's say that Bernie was the logistics person in the EOC and he had ordered a bunch of generators to arrive. Well, Margaret Ann could phone him and say, hey, Bernie, how's it going? Or he's probably busy and she's busy. Or she could just look on her phone on the app and see that the order's been placed and it's the ETA for that delivery is 6 hours or whatever. And you can share that information without bothering everybody, and people love that part. Let's talk about business continuity. I'm sure most of you have spoke to your clients or other business partners and stuff. One thing that COVID did was really highlight the fact that most organizations actually aren't ready for much. And in the government, and did we have, think back 2 years ago, did we have ventilators in our hospitals? No, not enough. Did we have masks? Did we have we didn't even have vaccine for a long time, obviously, but, all the things we didn't even have, hand sanitizer and different things. So how does that work now for your business? Do you have a supply chain? Do you know your supply chain? Do you have contracts in place? Do you have shipping partners? Is there going to be delays? Reputational issues, things like that. Anna from the UK there, and we use the Business Continuity Institute, which is the sort of the global standard based out of London, England, and it's the BCI Business Continuity Institute, and we use their guidelines. There's a Canadian chapter here, and this is really what we try and do is look at each business unit or process and put some sort of risk level to it. And this is called maximum allowable downtime. So what is our risk? Well, what if our email's not working? Is that a problem? Is it a problem if our phone's not working? We did some work with Fidelity Investments, and the owner of Fidelity out of Boston years ago said, every time a phone rings at Fidelity, it has to be picked up on the second ring. Because if we don't care about your money, you're going to find somebody else that does. And that was the owner's really strong point to make sure that it was answered. Well, what if their phone system goes down? We were talking to some folks at CIBC, and I forget what it was exactly, but I'll say it was $100 million for every half hour. The phone systems went down for lost trading revenue. Huge. So, what are your business models? What are your practices? Are you delivery? Do you send, construction people out to a home, renovations, all these companies? Is that a problem if it's delayed? Or what if you needed extra vehicles or things like that? So you decide, and you're either, we're good, we're busy, there's delays, and you hit that risk line. It exceeds your capabilities. Now we're in trouble. And then we're out of business, right? We're closed. And so what does that look like? Well, these are the 8 critical strategic priorities that we use. Again, BCI's guidelines on this. What's going on with our people, our facilities and infrastructure. If you've had an ice storm and you've lost your power, the building's fine, but there's no power. And the people maybe can't come into work because the highways are closed. Things like that. Is your IT system and applications, are they up? Is there a problem with your internet provider? People say the internet doesn't go down, but Bell, Rogers, TELUS, all those organizations, they might have an issue. Your own communications and product services, again, supply chain, your physical equipment, vendors, processing partners. What if we've seen this now for the last year or more with all the manufactured parts, including automobiles. They can't get the chips. Try and order a fridge these days and see if you can get a fridge in the next 6 months. Try and order a hot tub, try and order a car, all these things, they're really struggling, right? Customers and reputation. If there's a problem, people are on Facebook, they're on Twitter in seconds. You need to be able to combat that. You need to be able to get ahead of that incident, of that storm that's going on. And so these are tools that you can use. We have them, but I'm just sharing this with you because I think, many of you could point out some of these methodologies, to your customers or help them think through some ideas. What we do is we gather the information for every single department, and we know their facility, the utility, the type of systems. If we had to move offices because we've had a flood or a power failure, what would we need if we were sending 20 staff or 100 staff to another location? What kind of computer systems do we need? Phone, what type of software, security links and setups and passwords, and how would that happen? If people were working from home, again, we saw this. A lot of companies, obviously, in the last 2 years started working from home. But I remember people didn't even know what Zoom was. Right? So, stuff like this, if you have this documented, you're miles ahead, right? Is this your upstream and downstream? If your downstream has a problem, you can't deliver to them. If you're upstream, you're not going to get shipment. So, who's all that? Who's your suppliers and stuff like that? And this is what we call, I think this is really cool. This is the IBIA, the Immediate Business Impact Assessment Tool. Every department or every site, every Canadian Tire, every Tim Hortons, whatever, every manager, every school principal, whatever, could sit here and go, how are my people, my communications, my product and service, whatever that is. And this is all customizable. These could be different words. But infrastructure and equipment, supply chain, logistics, IT, reputation, and you're either going green, yellow, orange, red, black. Click, 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 and hit submit. And we're doing a test right now with a school board in Ontario. They have just over 100 schools. Well, every day at 8 o'clock in the morning, the principal or vice principal has to phone the board office and go, hi, Scott here. We have power. The lights are on, the toilet's flush, the teachers have shown up today, the school buses are coming in, We're ready for school. They hang up the phone, the next principal phones the school board office, and the next, and the next, and the next. And then they do this every 2 hours. And even then, the superintendents don't know the status until it's published by the admin staff. Well, what if they all just went, pick their zone, pick their school, secondary, elementary, whatever, click, 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 hit submit, and now everyone live in real time in 2 minutes knows the status. Or if a ice storm or tornado touches down or a flood or something, they would know at 2:15 in the afternoon which schools have power, which schools don't even have a roof, which schools have injuries, that kind of stuff. So this immediate situational awareness, as we tell people, and with our ELC program years ago when I was a medic on the helicopter, there was a big disaster going on, and we had a mayor, and I was in this police car in the back with the mayor, and there was another supervisor, and we were going to this location, and this poor fellow was a retired lawyer, and he was now the mayor. And all he kept doing was saying, "Don't let me look like an idiot," you know? And he had no idea how an emergency operations center ran. He had never been in one. You know, when we do training with some of the people, we'll joke and say, you know, some of you can't even spell EOC, you know, because they have no reference to it. You know, usually your fire, your police, those folks, they know how to do it. But then you get someone from HR or finance from the municipality or the region, and they're like, "I've never been in an EOC." You know, so it's again, that rapid decision-making capability. And then every organization needs some alternate strategies. If we're going to close this office and move somewhere else, what do we need to do? Does the strategic level, they need to free up some money or arrange some travel or support? Does the tactical team need to be ready at the receiving end? The person packing up the boxes or getting the staff out? You know, what are they doing at that? So everyone has these and it's really on two simple points. You either reduce demand or increase capacity. When you have an alternate strategy, you have to plan for. And when you talk to people about keeping it simple, they love it. With our stuff, they can click on these things. So this is you know, they'll fill this in, they'll see the results. If they click on this little icon, or over on the desktop there's icons, it'll take them right into their strategic alternate strategic plan, and they can see what they need to do and how they need to do and what their options are. And it works. It's simple, right? I just want to take a minute here and show you Poppy, or tell you a little bit about this. This is one of the partners that we've been working with for over a year now. This is not in emergency response. These are all just a brilliant group of people. I would say 80% of them are at least have one PhD. And Poppy is a pathogen monitoring system. It's about the size of a smoke detector in your house. Little unit, and it filters the air. Little quiet fan, you hardly hear the thing. And in the background, it's drawing the air in, and what it'll do, it'll pick up any airborne pathogen, and there's over 1,000. But it'll pick up COVID, but influenza, you know, Ebola, whatever. You know, it's gonna pick up all these kinds of things, flu, seasonal flu, whatever. And so you can actually see what's going on. And, you know, even at a micro level, if I take my hand and hit it down onto my desk, or I set some papers down onto the desk, it creates little eddies, and these pieces get airborne again. Or when people cough, you know, they always talk about that 2-meter distance. Well, the 2-meter distance isn't really accurate or relevant, because when I cough, it might go out 2 meters, and then some of it, heavier things, are going to land, but the lighter particles are going to maybe float around and go to a different space. Well, what we've been able to do with Poppy is put these into buildings. So like CIBC is now putting this in globally in their sites. Morgan Stanley, Vancouver Airport's been using this for a bit now, where they're now putting them in super yachts. There's over 500 companies that are now using it. Part of the thing is they want to be able to not just show their staff or tell their staff, but actually prove that they've put in protocols that are working, because they can do the testing and see if there's actual COVID or outbreaks in the air. When we discover an outbreak, we're usually 5 to 7 days ahead, so we can actually stop a larger outbreak from happening within the organization. We quickly identify it was found. Here's the 7 people that were in that area. You guys are now quarantined. You're staying at home. We can go in and deep clean and keep the organization operational. So with what we've done from Get Ready's side is we provide all the incident response. And so we'll talk to the client and tell them how to proceed and what they need to do in terms of cleaning. You know, the rules are changing all the time, as we all know, right? And people go, should we send them home for, is it 5 days, 10 days, 14 days? You know, it changes all the time. So, and they have an app and a tool, and it's been a real pleasure, and it's been very interesting to be able to work with Poppy. So it's something, you know, if you want some information on later, we can share that out or get it out to you. You know, I'm showing this daily screening tool, and this is always a tough spot for everybody, because this pandemic's been, you know, it's been exhausting for most. And I think people in general are just tired of it and they want it over. Well, have you heard about the stealth Omicron or the BA2 variant of the Omicron virus? Well, in China right now, they're having the biggest outbreak they've ever had. Denmark is now virtually closing down, and about 2 months ago, they opened up entirely. In England, they're getting it, and so it's more virulent or more health risk than Omicron is. It's apparently as spreadable, and I think the jury's still out, but this is the kind of information we've been getting. My point simply is, a lot of your clients in your own operations and stuff, this is probably going to circle it back. We're all in Ontario here in Canada. Our government's talking about getting rid of masks on March 21st and opening things up again. And it's just going to be bad timing. And what we're trying to tell our clients is don't just pack this up and put it away like you're done with it. Because by April, May, June, quite likely, you're going to be pulling it back out again. And then it's even more frustrating to get people to re-engage if you've completely shut it all down. So if you can keep them thinking about it, keep your screening active, have a record of who was there and what's going on, talk about the masking. It used to be we were told to wear masks so that we didn't cough it out. Now people should be wearing masks because a guy 100 yards away an hour ago might have coughed it out and it's floated down through the mall or the grocery store. And so you're wearing masks, not just to cough it out, but also to prevent inhaling it in or using your, respiratory tract as the route of infection. So, people talk about N95 masks and KN95 masks, a higher quality mask to prevent you from inhaling those viruses. And that's what that kind of thing is about. But I put this up on the screen. We've got a simple tool. We have hundreds of clients who use it every day. And we've been getting calls from people saying, I think we're going to, stop using this. And it's like, just hold on a little bit, because it's going to be a lot harder to get people re-engaged, than if you don't. So anyways, that's a screening tool. At the end of the day, they see all the results on the dashboard. They can sort it in seconds. It's touchless. People don't want to use pens and papers, and the managers don't want to pick up that pile of papers at the end of the day and sort it all. And the person at the end of the week nobody wants to do that. If it's touchless and it's digital and it's on your phone and it's a QR code, click, 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 click. It's easy, it's simple. And that's the kind of thing we sort of look at. And this collectively is all the different types of custom tools that we have, and, thousands and thousands of content and procedures. So if you have a client, we're happy to work with any of you. Hopefully this is helpful in some of your conversations for your own business and for your customers and stuff. If they want more information, or, we're always happy. We have a lot of referral partner groups that we work with. Bernie and I have talked for a long time, and we all know that, we don't know everybody. So we certainly count on the notion of connecting and using that ability to connect. And that's why I'm thrilled to be here today, and I appreciate the time. And this was the result we did from a survey at Trillium. When they surveyed before we came in, they had about a 30% employee confidence rating. And 2 months after we had installed and implemented the program, we had an 84%. Well, out of over 14,000 people, the executives saw that as just a huge win. And, obviously made the organization more resilient, reduced the number of accidents, reduced the downtime, and so on. So anyways, that's really the goal and the fun of it. So, I think you guys, have an email or my contact information, but yeah, I've talked enough. So